disasters, when we have inclement weather and infrastructure is destroyed. We need to declare a national disaster in terms of our infrastructure, particularly the infrastructure that was historically for Black people. It is in a state of disrepair. There's huge issues in terms of lack of resources, lack of support. What you need to ask yourself is, how are we different from an apartheid state? When we've now created a health system that we will not use ourselves. And I'm not speaking about the minister personally, because he goes personally to public service, but let's talk about the big picture. Where do we go as parliamentarians? Where does the Premier of Gauteng and his members of the legislature go for their healthcare? Where do the people that run the head office of the Gauteng Department of Health go for their healthcare? Where do the very staff that work in our institutions go to their healthcare? And that is fundamental to the crisis that we see.
Very important.
You have people that were involved in this. Some have resigned. They're already working in the private sector. Now, there are people that have not resigned, who work in the private sector and are employees of the public sector. Their attitudes to patients, the same person acts differently in the public institutions to the way they act in the private institutions. So we do not value lives the same. So part of our biggest problem as a nation is a values crisis, because the same professionals, it's not that they are not well trained, they just treat citizens differently depending on where they see them. And that's fundamental to the values crisis in our society.